taking a lot of heat. Speaking of taking a lot of heat, the congressman took a lot of heat a while back for his support of the Healthcare Reform Act.
Right.
He had several town hall meetings, and it was just a line of, organized Tea Party activists there basically to go after the president and Congressman Reyes as his proxy. What are your thoughts on the Healthcare Reform Act?
The Healthcare Reform Act addresses some really glaring deficiencies in our healthcare system in America. People with pre-existing conditions before this act could not get covered in many cases. Tens of thousands of people in our community had no coverage at all. And so they were going to Thomason University Medical Center and receiving emergency room treatment at a much higher cost than if they had received preventative treatment at a cost that you and I, in many cases, ended up paying as taxpayers into UMC. And for addressing those issues, I think that the Health Care Act was really important. What I'll tell you though, and I've spent the last 2 weeks going door to door in El Paso and talked to a lot of people, is that most people don't understand the act all the way yet. And I bet you, in fact, I guarantee you, if you ask 9 out of 10 El Pasoans, if you went out with your camera right now and asked them to explain the act to you, they'd have a very difficult time doing it. As a business owner who has 12 employees, who pays 85% of the healthcare costs for my employees, when I talk to my representative at Aetna and I try to project my costs for next year, we cannot do it. We have a hard time getting a quote because so much of this is still in flux. I called Patsy Slaughter of the El Paso Medical Society earlier this week and I said, tell me how El Paso doctors are feeling. Her answer is, we're still trying to figure this out. So it is what it is, it's passed. Now moving forward, what is my job as a representative for El Paso? I want to make sure that we do everything that's good about this act, which I just mentioned, and also make sure that it doesn't hurt El Paso businesses, that it doesn't hurt the consumers of healthcare, and that it doesn't hurt the practitioners within the healthcare system, the doctors, the nurses, the other medical professionals. One very real fear that they have, and they're the experts and they're still trying to figure it out, is that our already low reimbursement rates might be cut even further as certain provisions of this Healthcare Act are enacted and further legislation is passed. My responsibility as a congressman for this area would be to protect those businesses, to protect our healthcare workers, and if anything, our reimbursement rates, as you probably know, which are already too low, need to go up. Why does the El Paso doctor, why does the El Paso nurse get paid a lower rate than that same doctor or nurse in Houston, Texas, in Dallas, Texas, in New York City for performing the exact same procedure?
You could essentially make that argument about every industry in El Paso. I mean, that same argument can be applied to call centers. Why do people that work at call centers who are bilingual and providing an additional service get paid way less than people that are doing less in other parts of the country?
That's a great point. Let me just say this. It's a valid point about call centers. It's a valid point about a lot of the underpaid professions in El Paso. The difference is the congressman and the U.S. Congress controls aspects of the remuneration or the payouts that come along with Medicare and Medicaid expenses and expenses that will be reimbursed under this Health Care Act. So with that control and influence, let's fight for El Paso to get their reimbursement levels a little higher. So a well-intentioned act, I want to hope for the best in terms of how it turns out for El Paso, still in flux. And my job at this unique opportunity for El Paso and for the Health Care Act is to make sure that as it's rolled out, we are protected and that we come out ahead. And that's what I would do.
So a couple follow-ups to that. Number one, in theory, do you feel it's an appropriate role for government? That's one huge debate that's been happening across this country is, do you feel that mandated healthcare is an appropriate role of government? And second, I didn't really get an understanding of whether or not you support or not the Healthcare Reform Act. So how would you have voted if you had the chance to vote on that?
I don't know, and I'll tell you why, because I didn't read the act, and I don't know how many people who voted on it did read the act. I've done my homework. I've read just about every article I could on it. I talked to the congressman's chief of staff who called me and tried to get me to endorse the act before he made a decision to vote for it. I talked to the El Paso Medical Society, and I talked to everyday El Pasoans, and there's not a clear understanding of what the implications are. So it is what it is. I agree with the intentions, as I just described, making sure that people who have pre-existing conditions are covered, making sure that people who don't have health insurance have access to health insurance, making sure that the public's not on the line for people seeking emergency room treatment for health care that could have been delivered in a preventative fashion. But it is what it is, and so now how do we make sure that it's the best possible act for El Paso as all the accompanying legislation is rolled out. That's what we have to focus on going forward. What was the other question?
How would you have voted on it? But you actually kind of explained it from the beginning. You said you were really sure. I did want to kind of backtrack on immigration on one thing, because there was a quote you said in the paper recently that I thought was pretty interesting, and it was in regards to immigration, and you had said, you know, people need to understand that there's national implications for it. And you had made a statement, something, words to the effect, and if I get the quote wrong, you know, please correct me, but words to the effect that if members of Congress don't understand it, well, you go over their heads and you go to the American people.
Yeah.
If that's an accurate characterization of what you said, how is that different than the recall effort?
I don't understand.
Locally, essentially what happened at City Council, when you were a member of City Council on the domestic partner benefits issue, and
right.
You know, folks said, all right, well, we're not getting our way with City Council, we're going to go over City Council's head and go to the people. I mean, how is that a different
I don't
scenario?
know, you know, it may be different in degree and scale, and obviously completely different areas of policy, but I have no problem with people taking a recall petition to the streets and having the city council members who voted for it, and I was one of them, put to the test and put to the vote. I mean, if it's in our city's constitution, the city charter,
Sure.
and it's legal and it's free and it's a democratic process, go for it. I may not agree with their position on this, and I'm going to, as passionately as I possibly can, going to campaign and make sure that Steve, Susie, and John are not recalled to whatever degree I can help them with that. But that's part of our democratic process, and frankly, that's one of the things that in this era